in a little bit more detail. Also streaming on YouTube at Dr. Nathan Thompson. So guys, I hope you enjoy, and make sure that you share this video as well. We're getting ready to get started. Hey, good evening, everybody. Dr. Nathan Thompson here with Exemplify Health Center, a Wellness Way affiliate right here in Yorkville, Illinois. Happy Monday evening, guys. Hope you guys had a great weekend. And today we're going to be talking about dementia. Oh, man, this is something that probably hits home with a lot of people. I know it does in my life as well. But I want to go over with you how to know the signs before it's too late, guys. So many times I will go, the signs will always be there. It's just that we're not trained to be able to recognize them, whether they're physical symptoms or whether they're even symptoms that will show up on a lab. And guys, I'll go to my grave when we talk about this, is that things like heart disease, things like cancer, things like that, they should not come as a surprise if you are testing these things properly. So it's not like dementia is you're fine and then all of a sudden you have it just jumps inside your body one day. It's not like cancer jumps inside your body one day. It's not like heart disease, diabetes. These things can take years and years in order for them to develop. And if you are looking at these things and testing these properly, you can see yourself trending in these directions. And dementia is certainly one of those examples as well. So let's talk about dementia. And if you are joining us right now, make sure that you are saying hello. Let me know where you are watching from as well. And I always love to watch and am sincerely humbled when people are watching from all over the globe. And so I always love to see where you guys are watching from. So as we get into it, guys, let's go over dementia, how to know the signs before it is too late. And while we are watching people join us right now, just a couple of things that right now, actually, we are streaming live to our YouTube page as well at Dr. Nathan Thompson. So we're trying to see how well that goes. I know that I have actually had a lot of videos banned on YouTube, things that were actually not considered scientific consensus. But you got to understand who controls scientific consensus today, especially when it comes to Google and YouTube. And I recently actually had a video ban that was a private link. It was Make Immune Systems Strong Again. And it was a private link. I didn't share it with anyone, and YouTube took that down within 30 minutes. So guys, if you actually want to see the whole entire webinar that I have done a number of times that explains the immune system, that explains antibodies, that explains a T-cell response, how to test for it correctly, and also going over the why it's been a complete and utter failure and a disaster, why there's been so many side effects. It's not on YouTube, but you can find it on our Rumble page at Dr. Nathan Thompson, and it's for free. It's about an hour and a half long. It's a little bit long, but we do a lot of long format videos so that people can't take what we say out of context, especially. So you'll be able to find that video over there. Please watch that, because I think it does a great job of helping people to understand what the immune system is, what it's designed to do, and why actually when you go against physiology, why people will have issues with autoimmunity or myocarditis or endocarditis or whatever it might be. And I explained that in that video especially. So I know we got a lot of people watching right now from Cleveland, Ohio, from Ontario, New Zealand, awesome, from Aurora, Illinois. So awesome, guys. And so again, if you're joining us, make sure you say hello and make sure you let me know where you are watching from. So getting into dementia, guys, this is something that has affected me from a very young age. You know, I like in my own personal experience, my grandfather suffered from dementia and Alzheimer's disease. He passed away at 81 years of age, unable to speak, not really remembering all that much. In fact, really, I only knew my grandfather for about 10 years. And the last 8 years was just seeing him just pretty much whittle away to nothing. And so obviously dementia is just, it's really sad to know that a person's still living, but in reality, they truly have already died, especially if they don't have their cognition there. And so I know I have a lot of people who have loved ones who have relatives, things like that. You know, they're in assisted living. They may already have dementia. They're pretty close to, putting them into assisted living. And there's obviously some things we can do in order to help those people, but it's very difficult. And the reason why it's so difficult is because they literally are at the hands of the doctors and nurses who run a pretty tight ship there as far as not doing anything that could potentially benefit them. And you're really at the mercy of the nursing staff, and you're at the mercy of the doctor. They don't want anything extra that they have to actually take care of. So guys, the purpose of this video is not for those for you to ask questions like, I know so-and-so, they're in assisted living, what on earth am I gonna do? It's not for that, but it's actually to help you, the viewer, with your own life, to prevent you from becoming a prisoner in assisted living. All right. Now you have seen dementia, you have seen memory issues, brain issues, and it just seems like it's exploded over the last 20 to 30 years. And everybody else always goes down to, well, we're just diagnosing it more, like autism. We're just diagnosing it more. We're putting a fancy label behind it. And guys, I disagree with that. And one of the reasons why you're seeing it more, I'll go over some of the biggest signs, but also some of the biggest causes in regards to that. But also, guys, just remember, we live in a medical system today that has actually a wonderful ability to put out fires to help you live longer. But the reality is that you're living longer sicker. And so as people live longer sicker, you're going to be seeing a lot of issues more when it comes to dementia and brain deterioration. And so the reality is you don't start taking care of your brain when you're diagnosed with it. You start taking care of it now. And I'll go over with you guys some of the biggest causes, number one, and then number two, I'll go over with you how you would really start looking at this from a testing perspective. So as always, one of the things that we always like to do is we like to go to the Mayo Clinic because, you know, they're considered the experts when it comes to anything. And I always make the joke when someone around here can't figure it out, they're going to Mayo's. And guys, like I always say, is you can go to the very best diagnostician in the world, but if they're still coming from a medical perspective, the end result is still the same, which is going to be meds, more meds, surgery, or maybe something, you know, some kind of new and emerging type of treatment or medication. But guys, as always, the reason why it will be a failure is because it's never ever getting to the cause. And again, remember, there's a need and place for medicine. They do a great job as far as putting out fires. But one of the biggest disservices because of that is because no one's ever looking for causes. People, doctors will actually understand that inflammation, for example, literally is a root cause of every single chronic degenerative disease out there. But how we differ is how we actually take care of it. See, doctors are actually just trying to either fight the effects of the inflammation or to completely knock out the immune system and knock out an immune response, rather than try to find the reason why it's happening in the first place. So guys, if you actually go to Mayo Clinic and understand some of the symptoms that they talk about at the Mayo Clinic, so you're going to see problems with cognitive changes, especially when it comes to things like memory, verbal skills, things like that. So they'll say memory loss, okay, difficulty communicating or being able to find words, difficulty reasoning, problem solving, problems with visual and spatial abilities, such as getting lost while they're driving, complex tasks, difficulty planning, organizing, difficulty with coordination and motor function. Guys, this is very, very important because one of the things that I see quite a bit when people have some of the initial problems when it comes to dementia in particular is that they will lose the ability to be able to perform complex motor functions. This can be particularly true when it comes to performing complex motions when it comes to exercise. More on that in just a little bit, but they'll have a very difficult time actually doing things like hip hinging, going down into a squat, going into a clean. Very, very difficult for them to be able to do more than one motion or be able to change quickly direction when it comes to motor skills. And that can be specifically an early sign that there's already damage taking place. And then finally, confusion and disorientation. Now, some other things that you may see as far as psychological: personality change, depression, anxiety, inappropriate behavior, paranoia. One of the biggest things that you'll see agitation, hallucinations. By the time people have that, guys, they are pretty far gone. Now, there's different types of dementia that I want to talk about. They talk about progressive dementias. Basically, what they're saying is that there's no hope. This is going to progress and there's really no chance of these people actually digging themselves out of a hole. So you got things like Alzheimer's disease, you got things like vascular dementia. And that's particularly affected by cardiovascular disease, things like strokes. You have Lewy body dementia. And people have debated this whole idea behind Lewy body dementia, like what it actually is. It is, some kind of abnormal like proteins that we're seeing within the brain. What's exactly causing it? Is it toxicity? Is it due to a lack of cerebrospinal fluid flow? But Lewy body dementia as well. In fact, I've even had patients who have come in as young as 39 years of age that they couldn't figure out why why they had such problems with dementia. I have my opinions as far as why it is, but basically it was just kind of a garbage diagnosis saying, I guess it's Lewy body dementia. And again, this was a female that was only, in her late 30s. Then you have frontal temporal dementia. This is, basically any kind of damage to the brain in the frontal lobe into the temporal lobe. And a lot of the frontal lobe, guys, is personality, behavior, language. That's where it's primarily affecting them most. And then you have mixed dementia, which means, hey, most people, as they get to a certain age, they're going to have a combination of all of these different things. So basically, the Mayo Clinic is actually saying is that when it comes to dementias, it's multifactorial, guys. There's not one thing. Guys, this is true with so many degenerative diseases, is that it's not just one thing. It's not your cholesterol, or it's not just a tumor. It's not just this. It's not just your diet. Guys, all disease is multifactorial, which is why we look at it from a Swiss watch type principles. Now, there's other things that are related to dementia too, things like Huntington's disease. Now, this is Huntington's disease. It's something that is very genetic, and it will present itself usually within someone within their 30s and 40s. So you're actually looking at a very early type of dementia going on. Another big one, guys, is traumatic brain injuries. You guys probably heard about that when it comes to football, when it comes to the NFL, and some of these athletes getting traumatic brain injuries through multiple concussions that are basically overlapped on one another without full healing taking place. And you got the idea behind micro concussions as well, these small forces that are repeatedly done over and over for a period of years. Because what's interesting about traumatic brain injuries is that one of the biggest things that will take place when it comes to traumatic brain injury is you also have to consider traumatic upper neck injury as well, and how that actually will interfere with cerebrospinal fluid and its ability to be able to provide nutrients like glucose to the brain. It's about 2/3 of your brain's nutrition is actually coming from cerebrospinal fluid that needs proper motion of the upper cervical spine, of the lower spine, of the sacrum, the pelvis, that allows that pump to be able to flow up into the brain and back down, and be able to circulate nutrients throughout the brain. Then you also have infectious prion disease, and then obviously Parkinson's disease, which is associated with dementia as well. And a lot of Parkinson's, things like that, in which you have brain destruction, a lot of that can be related to toxicity, especially. There's a lot of different reasons why that's happening. When I've seen Parkinson's disease, traumatic brain injuries going on, toxicity that's going on. I also see a lot of times with people who have brain injuries, you're going to have a lot of leaky gut issues as well, and that has to do with anytime there's a brain injury, there's going to be leaky gut as a result as well. So dementia-like conditions that can be reversed. Well, just remember, just because someone is having dementia-like symptoms doesn't mean that they have Alzheimer's disease, because there's other things that can take place that will mimic dementia as well. Here's what's interesting. Infections, different metabolic problems that could be going on, because this can be related to things like thyroid issues. This can be related to problems with absorbing B12, something that could be just as simple as low stomach acid, having nutritional deficiencies, either a lack of nutrient intake or a lack of absorption. Very important when you are talking about stomach acid and you're talking about food allergies and things like that. Some of them can be medication type side effects as well. Guys, I'm going to show you in just a second medication side effects that can actually either cause dementia or mimic dementia as well, which is why we see so many people are having dementia. Maybe a lot of them, or some of them, are actually due to medication side effects. The doctor is not realizing or will not rule out only because the standard of care is to have people on these medications when they have other health problems. Brain tumors definitely can do it. Normal pressure hydrocephalus. Guys, if you get some kind of blockage in the cerebrospinal flow, and that can sometimes even be due to a brain tumor, sometimes can due to upper cerebral injury, things like that. You're not going to get cerebrospinal fluid flow, and this is going to cause cerebrospinal fluid to back up in the brain and in the ventricles inside the brain. You can get things like pressure buildup. When that happens, you actually will have brain shrinkage because of that pressure as well. So Mayo Clinic talks about risk factors that you can actually change, which is interesting because yes, diet and exercise, don't have too much alcohol, make sure that you are avoiding your cardiovascular risk factors, although the answer is to take a cholesterol drug, take your blood pressure medication, take your diabetes medication, depression, diabetes, smoking, air pollution. So they're actually saying that pollution or toxicity does play a role in it. They also talk about head traumas as well, not getting enough sleep, again, nutritional deficiencies, and medications that can worsen memory. I'm going to talk about things, not what they're talking about. They actually say over-the-counter sleep aids that contain diphenylhydramine, Advil PM, Aleve PM, and medication used to treat urinary urgency can cause problems when it comes to memory, okay? And so they're saying there's some things that are actually within your control, which is really interesting, okay? Now, guys, if you look at the Mayo Clinic and what they just said is basically they're saying this. When it comes to dementia, the question you really need to be asking is this. Well, what does it take for you to have a healthy nerve system? In other words, what does your neurology need in order to be healthy? Okay, so here's what it needs. Number one, it needs nutrients. It needs to be able to absorb your nutrients. Remember, you can't create something from nothing. Number two, it needs an energy source. And yes, it is preferably glucose. Oh, Dr. Nate, you can run on ketones. Yes, you can, but the brain prefers to run on glucose, okay? Now, it needs to be stimulated as well, and it also needs to stay uninjured, which you're really talking about inflammation and you're talking about toxicity. So there you have it. What does it take in order for a nerve system to be healthy? Is nutrients with right absorption. It needs a energy source, preferably glucose, where we're going to talk about insulin resistance, especially. It needs to be stimulated. How does it need to be stimulated? Most of you are thinking about to do just more crossword puzzles and Sudoku. And I'm going to say, no, it actually is much deeper than that. And it needs to be uninjured, which you talk about injury to the brain, injury to the upper part of the neck, and also your inflammatory markers, and then also toxicity, which is going to be huge as well. So the first thing that we're going to talk about, we're going to talk about nutrients, we're going to talk about absorption. Again, guys, this comes from PubMed in January 30th, 2022. So this is an article that's not even a year old. They say the interplay between polygenic propensity for aging related traits and the consumption of fruits and veggies on future dementia diagnosis. This is a pretty straightforward study, but basically what they said is that people who didn't have more than or less, they had less than 5 portions of fruits and veggies a day, was associated with 33 to 37% increased risk for dementia in the following 10 years, okay? So they say a diet rich in fruit and veggies is an important factor influencing the subsequent risk of dementia in the next 10 years follow-up, especially in the context of polygenetic predisposition to Alzheimer's disease, even schizophrenia and general cognition, which makes you wonder that maybe nutrition plays a role in brain health. And they were just talking about more than 5 servings of fruits and veggies per day, okay? And so this is why when mom says get your veggies, why this is very important. Which is more important, fruits or veggies? I'll always say vegetables are more important because they're lower in sugar, which we're going to talk about in just a second. So they're actually saying that yes, nutrition plays a role. Now, here's another thing too. It's going to really inhibit the absorption of certain things within your body. This comes from, again, PubMed 2020. Article is just a little over 2 years old, about 2.5 years old. And it's called Proton Pump Inhibitors Act with Unprecedented Potencies as Inhibitors of Acetylcholine Biosynthesizing Enzyme, Plausible Missing Link for their association with the incidence of dementia. Guys, how many people that you know right now are taking a proton pump inhibitor? Dr. Nate, what is that? Proton pump inhibitor is taking a medication for acid reflux. Basically, what it does is it lowers the content of stomach acid within the stomach, because doctors think that low stomach acid is the reason why you have problems with reflux. That's not the reason why. It's actually low stomach acid is the reason why you have acid reflux, not because you are producing too much acid. I want you to think about it, guys. You're either in fight or flight or rest and digest. If you're in rest and digest, you'll actually be able to produce and secrete exactly the right amount of acid. If you are in fight or flight, the only thing that can happen is it's going to go down. Your body will never produce more acid, as if the body messes up. Same thing they say with autoimmunity. The immune system is just attacking itself all randomly. We have no idea what's going on. You either believe that the body messes up and makes mistakes, at which point you're going to try to manipulate the body in perpetuity for the rest of your life, or you're going to say, well, maybe the body's intelligent, maybe it's smart, maybe it doesn't make mistakes, maybe what I'm doing is causing it to adapt in this way. So when you look at this, what they're saying is acid reflux medication, there's association with that in dementia. And so the reason why they say this is because basically they're saying, okay, we know that it's causing dementia. And the reason why is because it inhibits the synthesis of a neurotransmitter known as acetylcholine. This is needed in the stomach. But here's what's interesting is acetylcholine is also needed in the brain, and it's the primary neurotransmitter that's responsible for making memories. Isn't that interesting, guys? This is well known that a proton pump inhibitor can cause dementia. It took them 20 years in order to figure that out, which, guys, anytime that they're saying the science is settled, this is safe and effective, and the drug or the therapeutic has been out for 6 months, there is no way on God's green earth that they can definitively say that it is safe and effective. Yet when this comes to proton pump inhibitors and its inhibition of manufacturing acetylcholine, guys, remember, it happens in the stomach, but it also happens within the brain, and that's the neurotransmitter that links neurons together for you to be able to make memories. Isn't that interesting? So are the doctors now, when they put you on a PPI, are they actually contributing to the rise in dementia? My opinion is yes, 100%, absolutely. And guys, if you actually would look at the number of people we have helped get off of PPIs, only because we identify what the cause is, remove it, allow the body to start functioning, start to heal on its own. Now, here's another one. I've talked about this ad nauseum when it comes to cholesterol-lowering drugs or statin drugs. This is coming from May of 2022, 6 months ago. Brain cell type specific cholesterol metabolism and implications for learning and memory. Here's what they say. Cholesterol homeostasis is vital for brain function. Brain cholesterol is locally synthesized with varying synthesis. And I apologize, my camera is right in the middle of capacities across different cell types. Moreover, brain cholesterol horizontally transfers across various cell types, not only to accommodate distinct cholesterol needs, but also to fulfill regulatory functions within target cells. What are they saying? They're saying that you need cholesterol in order for that is vital for brain function. Don't let anyone tell you that the lower your cholesterol is, the better. It's simply not true. Cholesterol is critical for normal brain function. So what happens if you see that they say, well, your cholesterol must be under 200? That's just what we have found. But what if your body says, no, I actually need more than that in order to be able to provide healing and repair and normal function to my brain? Now, here is also a study. It's about 13 years old. Statin-associated adverse cognitive effects, a result from 171 patients. Well, they surveyed 171 patients, and here's what they found. Out of the 171, 128 of them, or 75%, experienced cognitive decline determined to be probably or definitely related to statin therapy. Isn't that interesting? So in this small study, yes, 75% of them experience cognitive decline. So here's what's interesting. Grandpa goes to the doctor. Grandpa has high cholesterol. Grandpa is given a statin drug. Grandpa doesn't tell anyone that he's taken a statin drug. Grandpa starts to have problems with dementia-like symptoms. Grandpa goes back to the doctor and is diagnosed with dementia, but never ruling out that maybe it was primarily induced by going on a statin drug. Now, of 143 patients who reported stopping statin therapy, 128 of them, or 90%, reported improvement in cognitive problems, sometimes within days of statin discontinuation. Okay. Now, of interest, in some patients, a diagnosis of dementia or Alzheimer's disease reportedly was reversed. Now, Dr. Nate, are you telling me to go off of your statin drugs? I don't have a license in order to get you off of drugs. I can't tell you what you should do. Guys, this is something that you should definitely be talking to about your doctor. And your doctor, especially if you know someone who is experiencing some of those symptoms, should talk to your doctor about that. Because remember, doctors need to doctor. Doctors shouldn't just look at a template as far as how to take care of you, which in a lot of cases, as soon as you have these blood markers, it's this, 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 and this with no exit plan. Remember, we should be doctors and not just diagnosticians, meaning this is the template. This is what we're supposed to do. I don't know if it's going to help you. In fact, probably not going to help you, but at least I'm practicing, according to these specific guidelines and templates. Okay. So cholesterol modulates the rate and mechanism of acetylcholine receptor internalization. Here's what's interesting. Stay with me, guys. Is that stability of the nicotinic acetylcholine receptor of the cell surface is key to the correct functioning of the cholinergic synapse. Okay. So what do they mean by this? Is that, guys, cholesterol in the brain is necessary in order for normal acetylcholine neurotransmission in order for you to be able to remember. So what do you think happens when people are taking their statin drugs and they're inhibiting this, and now they are having problems with forgetfulness, with verbal skills, they're getting problems with remembering directions, basic tasks, and things like this? You look at those two different medications and look at the number of people who are on proton pump inhibitors and cholesterol medication at the same time, and it's no wonder that their brains are rotting. So let's talk about nutrients and absorption. What is so important? Number one, guys, stomach acid by far and away is important. Don't let anyone tell you that cholesterol, stomach acid is not important. The reason why stomach acid is so important, guys, is because most people think they're producing too much and they're not producing enough. And remember, being in fight or flight, and you can be due to mental stress, chemical stress, any kind of physical stress going on, that will increase fight or flight in the body, decrease stomach acid. So you actually need an appropriate amount of stomach acid to be able to sterilize your food, be able to break down your proteins, and also to be able to absorb things like iron, to be able to absorb minerals, to be able to absorb vitamin B12, for example. And you need those things in order for proper neurological function, but normal body function as well. Guys, you also need cholesterol. Okay, there's no such thing as bad cholesterol, guys. What there is that cholesterol is produced based on demand and it's not messing up. You need to figure out why your body is starting to produce an increase in cholesterol, particularly LDL. If you guys understand your hormone physiology, you'll understand that even being in a stress state will increase LDL. If you need to increase cortisol production, LDL must actually go up. So this is why things like having proper stomach acid and also, stopping this whole idea where I must lower my cholesterol to just ridiculously low amounts. Guys, you get your cholesterol under 150, you're going to have some big time problems when it comes to especially hormone production. This is why actually taking liver or eating liver is so important. This is also why, guys, low glycemic vegetables are so important. So remember, they say eat your fruits and eat your vegetables. The reason why I say low glycemic or having a glycemic index of under 50 approximately is for reason number two, because so many people are having blood sugar issues. It's actually leading to insulin resistance of the brain. And another thing that's going to be really, really good when it comes to brain health is going to be either krill oil or cod liver oil. Okay. So it's important to be feeding the brain healthy amounts of fat. So number two, we talked about the brain and what it needs as far as an energy source, that being sugar. Okay. Well, so-and-so eats a ton of sugar. They can't necessarily get it to the brain. Well, this is because, yes, the brain can become insulin resistant, just like the liver can become insulin resistant, just because your muscle cells can also become insulin resistant, and also the brain can as well. So type 2 diabetes mellitus is associated with brain atrophy and hypometabolism in this study. So type 2 diabetes mellitus may accelerate cognition deterioration in patients with MCI by affecting glucose metabolism and brain volume. So here's what's interesting about this is there a blood sugar component when it comes to dementia? The answer is yes, 100%. Here's an interesting graph. This comes from the Journal of Neurology of May 2005. Here's the article. They actually say that your hemoglobin A1C was identified as a risk factor for a greater rate of brain atrophy. Okay. Clustering of factors associated with metabolic syndrome and subjects with high hemoglobin A1C suggests the link between this syndrome and late life brain tissue loss. So here's what's interesting of what they said in the study is they said that the longer your A1C stays above a certain amount, you're going to see accelerated brain atrophy, or the overall volume of the brain. So what's interesting is where the sweet spot actually was, because as we get older, we'll see small changes take place within the brain. And so having an A1C of 4.4 to 5.2 demonstrated the lowest amount of brain atrophy. You get it to 5.3 to 5.5, you see that it goes up pretty dramatically. 5.6 to 5.8 goes up even more. 5.9 to 9.0 is going to go up to its highest amount. But here's what's interesting is that this level of 5.3 to 5.5, this isn't even considered, guys, pre-diabetes. So it's not considered pre-diabetes until 5.8, 5.9. So even at 5.3 to 5.5, you're still looking at twice the rate of brain atrophy if you could keep your A1C under 5.3. So isn't that interesting that yes, your blood sugars, your average blood sugars, which is known as hemoglobin A1C, plays a huge role as far as the brain health and the volume of brain tissue that you have. So this comes from a brand new article, not even a week old, from Helio News in their neurology section, Alzheimer's disease cognition. This is this specific subject. They said consumption of ultra-processed foods is linked to cognitive decline. Well, what is ultra-processed foods? What is it high in? It's high in sugar. So it's high in processed refined grains that are going to spike your blood sugar very quickly. This is what's interesting about this, guys, is that the people that they studied, 10,775 participants, the average BMI in these people from Brazil was about 27. So that's not even considered obese. These are pretty much people considered at a normal weight. So their 27% of their total calories came from processed foods. So participants reported more than 20% of daily calories from ultra-processed food, demonstrated a 28% increase faster rate of global cognitive decline compared with those who reported no more than 20% of daily calories from ultra-processed foods. So isn't that interesting, guys? Is that a lot of times your doctor wants to blame everything on obesity. Like all your problems are going to go away if you just lose weight. Guys, it's not necessarily the fat cell that's the culprit. It's what you did to create the fat cell That is the culprit. What you did to create the fatty liver, what you did to cause the liver to package up those sugars to form a fat cell, that is more important than the fat cell in and of itself. So they're actually saying ultra processed foods is causing cognitive decline. Okay. So when you come to being able to supply your brain with a healthy amount of energy, the biggest thing is that you need to actually decrease your sugars in order for the brain to become more sensitive to sugar. So it's kind of like saying, hey, how do I become more sensitive to nicotine? Well, the answer is to stop smoking. If you stop smoking, you'll become more sensitive to it. How do you get the brain more sensitive to glucose? Well, first you got to actually measure. So what's your A1C and what's your insulin levels? Guys, if you look at A1C, just like we said, you should be at about 5.2 or under. And then if you look at your insulin response, that insulin response, which your doctors aren't measuring, should be between 3 and 5. Yet most people, when we measure them, are usually between 10 and 20, which means even if you have normal A1C, you're actually developing insulin resistance, in which once that continues, you'll see your A1C continue to climb up because you'll lose the ability to be able to control your blood sugars with the amount of insulin that your pancreas is able to keep up with. So number two, what influences also your blood sugars is also stress as well. A stress response will increase blood sugars. So if you're spending most of your day in a high stress state, your blood sugars will stay elevated throughout the day. And then another thing that will massively influence your blood sugar levels is short chain fatty acid production. And what produces short chain fatty acids? It's your microbiome. Well, I mean, Dr. Nate, well, then do I just need to take a probiotic? It's a little bit more complicated than that, because what you need in order to have a healthy microbiome is you actually need a non-inflamed, healthy mucus layer within the microbiome that gives a good house for the actual bacteria to be able to live. So how's your mucus production? Are you actually eating enough fermented foods? And on top of that, are you actually creating or consuming enough of prebiotic fiber that could then provide the food for the microbiome to be able to produce short chain fatty acids? So this is why when we look at people's blood sugar, it's a lot more in depth than just saying, hey, you just need to eat less bread. If you just eat less bread, I guess all of your problems are going to go away. And this is why testing is so important. And all these things can actually be tested. So then moving on to the next thing about the brain. The brain needs to be challenged and the brain needs to be nourished as well. So this actually comes from, again, PubMed. It's an article about 6 years of age. Title of the article is Mobility and Upright Posture Are Associated with Different Aspects of Cognition in Older Adults. You know where I'm going with this, guys, is that if you go to the nursing home and you look at people who just aren't there anymore, go ahead, guys, and look at their posture. There's a reason why we call it the granny posture. There's a reason why we call it the nursing home posture. What I'm talking about is excessive forward head rounding of the shoulders. You start seeing that the upper spine begins to lean forward and the upper back begins rounding as a result. So this is actually a study that they did of 160 healthy older adults aged 50 to 89. Basically what they said is they looked at two different components: visual motor performance and verbal episodic memory. They said our primary predictor variables were two aspects of motor function: timed up and go speed and neck angle. Okay, so what they mean by timed up and go was your ability to be able to quickly get out of a chair. Okay, so you'll notice people get older, they have lost the strength, they've lost the mobility to be able to quickly get out of a chair. You may have noticed some people, they have to rock back and forth 4 or 5 times before they develop the momentum and the strength to be able to get out of a chair, also known as timed up and go. And then the second thing was looking at their neck angle. So when you look, guys, at a neck angle, you're talking about how the head is shoved forward in front of the body, also known as forward head posture. Here's what the results were. Poor visual motor performance was best predicted by a combination of age, BMI, slow, timed up and go, whereas poor verbal memory performance was best predicted by a combination of age, being a male, low education, and then acute neck angle. So you mean to tell me is that the position of my neck and head can result in poor verbal memory performance? And the answer is yes. I'm going to show you in just a second. The conclusion, upright posture mobility, were associated with different cognitive processes, okay? So what they're saying is your ability to move and the position of your head and neck were big things as far as your balance, and also a big predictor of verbal and memory skills as well. Now, here comes another article. This is about a week ago. Exercise stalled cognitive decline among adults with mild cognitive impairment. So what's so interesting is that they actually looked at people and they had mild cognitive impairment. And most people know is get off your butt and start to move. These were people who actually just did moderate to low intensity cardiovascular exercise. But after a period, I believe, of 12 months, they actually found that their cognitive impairment was completely stalled, meaning it didn't get worse. Remember, a lot of times people will say, well, once it goes, that's only going to get worse. And this is just doing by low to moderate intensity exercise. Well, I have something that I believe would be much better than than just doing walking or things like that. You should actually be involving the whole entire body, start reconnecting the brain back to the feet, reconnecting the brain back to the hands, the brain back to the hips by doing complex motor type skills and also building strength at the same time. Now, when you talk about this neck angle, here's one of the reasons why, guys, is because of this, is that if you see someone who has what's known as granny posture or nursing home posture, in which you see this exaggerated forward head in front of their bodies with the rounded upper back, one of the biggest things that the damage that this does is it will severely impair movement of the upper neck. So when you have impaired movement, especially of the upper neck, is that most of a person's proprioception or joint awareness is actually positioned in the upper neck. So if you guys look at all of your joint receptors that are in your hands and your joints and your elbows and your wrists and your feet, guys, it is loaded with joint receptors within the hands. It's loaded with joint receptors of the feet, which is why this is so important to make sure that you're moving and exercising. But where it is primarily loaded is in the upper part of the neck. And the reason why is because the brain always wants to be horizontal with gravity. The eyes want to look straight out and have an even horizon. When this stops moving, especially the upper neck, it stops providing feedback back to the brain to be able to tell it where it's at within space. And this is why, as people are getting older, especially when they have an excessive forward head, why they start losing balance, become much more unsteady on their feet, because they're losing joint awareness. Here's the other reason why. If you look at the cerebrospinal fluid pump, which is providing the brain with glucose, how that cerebrospinal fluid gets pumped is through normal motion of the pelvis and of the upper neck and its ability to be able to flex and extend. So I want you to think about this, is that a person's neck is almost like the windmill that will provide glucose and will provide joint awareness going back up into the brain. This is why, guys, this is so important, is that who is actually measuring or x-raying your neck in order to see how it's affecting the brain. So I'll give you a perfect example. Here's a person suffering with dementia. Now, is this the only thing that's causing dementia? Absolutely not. Because again, it's multifactorial. So if you look, eyes, there's the teeth, there's the back of the head. Here is what the neck is in a normal position. And this is this individual right here. So what do you see? You see excessive forward head, and you'll see a lack of motion in through the upper part of the neck. You ask this person, hey, can you look up to the ceiling? And it's all it is this. where on earth is the proprioceptive stimulation? It's not there. How on earth is the cerebrospinal fluid supposed to be able to flow normally? It can't. And then we also point out that probably some inflammatory issues with this dental work could also be contributing to that as well, if you look at the number of root canals that this person has. So when you talk about stimulation, the nerves must be challenged and it must be stimulated. So here's the first thing. What is your forward head posture? So do you know what it is on an x-ray? Guys, I take an x-ray on me at least every single year, and I measure my forward head posture. Actually, my forward head posture is under 10 millimeters. So you look at this person, they're at 36 millimeters of forward head posture. Anything over 10 millimeters is significant. So has someone actually x-rayed you in neutral position from the side, from the front, but then even looking at motion by taking a flexion extension view and seeing if those bones are actually opening up and providing proprioceptive input and the ability of it to move to provide cerebral spinal fluid nourishment back up into the brain. So this is where, guys, corrective chiropractic care is huge. Guys, I'm a chiropractor by trade. And guys, this is why we x-ray, we re-x-ray people with new motion x-rays in order to see that things are improving and getting corrected. So if you're going to go anybody that's worth their weight in salt, they should actually be taking an x-ray, should be taking a motion x-ray. They should actually be able to give you a program in which it's going to be corrected and then follow up with different markers in order to see if this is actually improving or not. Let's talk about fitness, okay? Because when it comes to fitness, what are some of the best things that you can do in order to be able to challenge the brain, but at the same time also help with blood sugar control and insulin resistance? The answer, guys, is to be able to do high intensity functional type training. I always say this, is that we just showed you that doing medium or moderate intensity workout for long periods of time actually stopped the degenerative process when it comes to dementia or cognitive impairment. But guys, if you're going to exercise, then you should be now influencing your blood sugar. You should also be actually challenging the body through complex movement. Because again, how does the brain challenge? Because you're moving multiple joints in multiple different planes of motion. So if you're going to exercise, you should be doing all of it at once. That's going to provide an increase in strength, that's going to provide an increase in balance, that's going to make an individual more sure on their feet, and then at the same time, exercise in a way that is going to have the greatest impact when it comes to your blood sugars. Now, here's the last thing. We talk about uninjured and uninflamed. How many of you have actually gotten a test in which the doctor measured what is known as homocysteine? So here's an interesting one, because homocysteine is an inflammatory marker, and it has to do with a process known as methylation. Methylation is a process that occurs all over the body, except 95% of it actually occurs within the liver. If you've ever heard of things like MTHFR, these people who have that can have some challenges when it comes to methylation. And methylation is actually involved in numerous processes, including making things like serotonin, making adrenaline, converting carnitine into creatine for muscle strength. But it also is very, very important when it comes to detoxification as well. So in this article from literally about 2 months ago, not even, homocysteine, cognitive functions, and degenerative dementias. Here's what they said. There's a strong evidence that homocysteine is a risk factor not only for cerebrovascular disease, but also for degenerative dementias. A recent consensus statement renewed the importance and the role of high levels of homocysteine in cognitive decline in several forms of degenerative dementia, such as Alzheimer's disease. So which doctor has measured your homocysteine levels? Because homocysteine is needed in detoxification. It's also needed in methylation as well. So if people have this buildup of homocysteine, you can actually run a methylation panel and figure out where the break is in the dam in which they need the most support. It's not just as easy as just taking more, B9 and B12 in order to provide more methyl donors. There's other reasons why that could be happening as well. Here's an actual clinical example. So this person, you can see we measured homocysteine levels, and this was about a year ago. We measured it in this person, and his levels were over 30. Guys, 15 is the upper normal range limit, and actually where you wanted to see it at is around 8 to 9. This was at 30. A massive problem with some kind of detoxification problem or some kind of methylation problem. I will also have you know that this was actually after the second updated gene therapeutic, if I can say that. And we saw his homocysteine levels go through the roof. Guys, remember, homocysteine is an inflammatory marker. Homocysteine is also a marker for cerebrovascular accident. So the question is what would happen if he continued to get an updated one every single year, like they're recommending right now? Well, there would have been a very bad problem, in my opinion. But you'll actually notice that after 6 months, levels went down to 8. Levels stayed consistent between 8 and 9 on retest. And guys, one of the reasons is because we identified it. We knew what to do in order to begin breaking that down. But how many people are coming in with elevated homocysteine levels and they're not measured and they're allowed to persist in order to damage the vascular system? When the vascular system gets damaged, remember, what is nourishing that artery or nourishing the neurons? It needs an arterial supply to be able to provide it with nutrients and oxygen. So when you talk about inflammation and toxicity, what are your inflammatory markers? Do you know what they are? C-reactive protein, homocysteine are the two best, in my opinion, as far as inflammatory markers are. Do you also know things that can also contribute to inflammation, like things like food allergy, having infections within the gastrointestinal system? That's why a stool test can be important. Do you know if you have an excessive viral load with things like cytomegalovirus, Epstein-Barr virus, parvovirus? So what is your viral load? Because guys, again, you're going to be very inflamed if your immune system is not able to handle specific viral loads. And another thing that will cause inflammation is having a fatty liver, which most people in the United States actually do have a fatty liver, okay? So, 2/3, I think it's now, of people in the United States have what's known as a fatty liver. And when that liver becomes fatty, and guys, this is not just it gets fatty. We're talking about non-alcoholic fatty liver disease. Yes, alcohol can do it, but now the majority of fatty liver cases are due to non-alcoholic fatty liver disease, and this is due to the overconsumption of simple sugars. Guys, this is why whenever anyone says, well, it's just too much calories, and the way to lose weight or way to get your health back is just eat less calories, lose the fat, and all your health problems are going to go away. It is simply not the case. So all of those things can contribute to your inflammatory levels. And again, guys, if your liver is becoming fatty, detoxification is going to be impaired, which is why not only can you become toxic, but number two, you can start to have some real big problems when it comes to hormone metabolism. So guys, here's what you can do, okay? Here's what you can do. There are things in your control that you can do. We went over some of the things that you can actually start doing right now. But number one is get tested, all right? Get tested. You should be working with a Wellness Way doctor. I know we have so many people who reach out that are from different parts of the country or different parts of, Canada or New Zealand, Australia, Europe. And for us, our remote consult schedule is full. And we also work in full-time practice, seeing people individually in person here at the office. But you really need to find a Wellness Way doctor. Either go onto the wellnessway.com and find a practitioner that will be nearest to you. And if you can't find one, please reach out to corporate at the Wellness Way. Say, I want to work with someone, and they will pair you with the doctor who has availability to work with you remotely. But how do you get a person better? You have to address physical stressors. We just talked about that with an X-ray. We talked about chemical stressors. In fact, measuring these things. This is why, guys, looking at food allergies is so important. Looking at infection, looking at viral load is so important. Looking at things like A1C, looking at your insulin levels, things like that. And don't ever downplay the role of mental stress, guys, because mental stress is absolutely huge. And if you understand the physiology behind it and the hormonal response behind it, and while it will cause so many problems with lowered immunity, gastrointestinal issues, and it's not the body messing up, the body is doing exactly what it's supposed to do. And mental stress can be huge, which is why if you're having issues with mental stress, you either need to learn how to handle the stress better, become more resilient, or understand what you need to do in order to take yourself out of that chronic stress situation. So the biggest thing that I will tell you guys, because people reach out to me all the time and they'll message me all the time and they will say, what do you do for this? What protocol do you have? And if anybody's giving you a protocol, please run away from them because a protocol is not you. A protocol is not individualized. A protocol is a great way for a lot of doctors to make money, and hopefully it helps 25% of people who just absolutely have the testing to match that specific protocol. So you need to stop treating conditions. You need to stop treating your weight loss resistance. You need to stop treating your dementia. You need to stop treating your pain. You need to stop treating your hormone imbalance. And rather than treating conditions, work on starting to improve your health. And this is why people say, oh my goodness, how did this person get better? What was the protocol? Then we identify where a person was inflamed. We identified where they were insufficient. We try to figure out why they were insufficient. We didn't have to dump a bunch of nutrients in. We didn't have to give them a protocol, but instead we understood the body knows how to heal itself. And if you start to identify what is inflaming the body first and foremost, that will set you up for having success later on when it comes to healing and when it comes to repair. And that's why you have to be able to identify physical, mental, and chemical stressors. So guys, if you enjoyed this, please make sure that you share this video with others. Tag someone who might be suffering or knows someone who might be suffering with dementia. And again, this is not so much in order to help the people who are already there, but to help prevent you from living in that prison down the road. Remember, you don't think about health when you're sick. Think about health as one of your priorities every single day so that you don't wake up being sick and say, what on earth happened? I should have done something a lot sooner. And this is why, guys, inflammation is so important. And guys, coming up in January, around, I believe, the 15th, we should have the link posted. If it's not there, we posted soon at the top of our page on Exemplify Health Center, also on Dr. Nathan Thompson, about the next inflammation talk that you can register to so you understand what it is, where it's coming from, and why that's the first thing that you must address when it comes to understanding how to get your health back. So guys, I hope you have a great rest of your night. I hope you enjoyed this. I hope you share it with lots of people. And for those of you who watched, thank you very much for doing that. Thank you very much for sharing. I'm always honored. I'm always humbled when you listen to me over the course of an hour. And so if you also have another topic that you'd like to hear about, just go ahead and put it in the comments below. I will be back next week, maybe even before that, to give you some updated information. But next week, I'm sure we'll have something that will be hopefully just as good as what we went over tonight. So guys, be well, be blessed. Remember who you are.